We were here really to talk about the behavioral health emergency that's occurring not just in the United States, but it sounds like Canada as well. And what can we do collectively to try to address that as payers, as health plans, as providers, as public policymakers, as family members, and as a community.
And I can share with you that I think as we look at saving lives, saving our community, and saving money, that's a really good nexus for good public policy.
It's really difficult to afford to live in America right now. Housing costs, childcare, healthcare, and people are feeling really strained, and that's affecting behavioral health, and in turn, that affects everything else.
How do we get a conversation around prevention? What do we do before we have the crisis? And it's difficult to do because if we're in crisis, we really need to take that acute care perspective.
There's all kinds of policy change, what we cover, what we don't cover, how we pay for it, how we pay the providers who are doing the services, where those services are located, who has access to them and who doesn't, how do we facilitate the access, and then how do we really start getting upstream and focusing on the determinants of people's behavioral health, and that requires a whole of government approach.
I think there's some initiatives, certainly in some states and at the federal level, that is starting to really recognize the importance of addressing behavioral health. I like to say that at a national level right now, behavioral health is one where Democrats, Republicans really can agree and have been passing some meaningful legislation to support and resource behavioral health more.
Just the fact that we're having the conversation about how to access mental health care and behavioral health is wonderful.
I think we just had a great conversation and really appreciate Regents kind of setting the stage for talking about virtual care and behavioral health.